Hello, everybody. Can the back of the room hear me? Great. Okay. My name is Elizabeth Sobel Blum. I'm from the Federal Reserve Bank of Dallas in the Community Development Department. I'm speaking today about how employers can support and promote healthy communities, so a continuation of this morning's conversation. A quick disclaimer, the views that I'm expressing are not necessarily those of the Dallas Fed and Federal Reserve System. Okay, a brief overview of the Federal Reserve System. Here in DC is the Federal Reserve Board, and then we have 12 reserve banks. I'm in the 11K, the Dallas Fed, which covers all of Texas, northern Louisiana, and southern New Mexico. Okay, health is an asset. When people commonly ask, why does the Fed care about health? In a nutshell, it's because the health of our economy affects the health of our nation, and vice versa. The health of our nation, our people, affects the health of our economy. Why is this? It's because there is an inextricable link between health, education, and income. Let me give you some examples why. We know that on average, 25-year-old college graduates can expect to live 8 to 9 years longer than their counterparts who have not completed high school. We also know that, in general, the more you learn, the more you earn over your lifetime. Also, we know that kids from the lowest income households are 2 to 3 times more likely to be obese than kids from the higher income households. So, how are we as a nation doing? Not very well. It turns out that 30 countries have infant mortality rates that are lower than ours. 26 countries have longer life expectancies than we do. 1 of every 3 children in the United States is overweight or obese. And 1 out of every 5 children in the United States are poorly housed and educated. This achievement gap, in terms of educational achievement gap, translates roughly into a $1 to $2 trillion loss in GDP per year. That's the equivalent of about 9 to 12.5% of lost GDP per year. This is what some have called a permanent national recession. So what can we do about this? So this briefly, Nico pointed this out before, but let me just emphasize this. It turns out that only 20% of our health is based on what happens in the doctor's office in terms of access to health care and quality of care. Of course, this does not trivialize the importance of medical care. Clearly, when you're sick and you need to get medical help, there's lack of medical care is no consolation for if you don't need it. If you do need it and do not get it. So what do we do about this? It turns out that zip code matters. Let me be more specific. It turns out that our genetic code tends to be a more accurate predictor of our health status. Our zip code tends to be a more accurate predictor of our health status than our genetic code. Let me repeat that and make sure I'm saying it right. Our zip code is so important that it tends to be a more accurate predictor of our health status than our genetic code. This is a map of New Orleans, and that shows that children, babies born in a neighborhood close to the French Quarter, can expect to live to the age of 55 years old. If you look several miles northwest of there, children born in a neighborhood that's close to Lakeview can expect to live to the ripe old age of 80. Look at that generation gap. This is based not just on programmatic issues and individual issues. This is based on the systems that are creating the environment in which people are either thriving and living to the fullest potential or not. And unfortunately, this is a pattern seen across the United States. This is not unique just to New Orleans. So, who's in the zip code improvement business? Let me start with the community and economic development industries. Our organizations in these industries do a variety of things, including building high-quality, affordable housing with wraparound services, such as healthcare, financing community facilities, such as charter schools, child care centers, community centers, grocery stores, and health clinics. They support small businesses and micro-entrepreneurs. So for example, a micro-entrepreneur is someone who isn't yet credit-worthy to go to a mainstream bank, but might go to a micro-finance institution such as the Lyft Fund, which used to be Axion, Texas, and not only ask for access to credit, but also business training services, such as how to do cash flow, how to calculate cash flow, do marketing, et cetera. Also, in community development industries, help individuals build and repair their credit and access quality financial products and services. So this speaks to the issue of, for example, payday loans. Many times, often, people who get a payday loan end up being worse off financially than where they started. So it's about making sure that, for example, people get access to credit that's safe and sound. So what opportunities are there to engage in community and economic development? So my argument is that community and economic development is healthy communities, and vice versa. Healthy communities is community and economic development. Traditionally, when you think of community and economic development, it does not necessarily intentionally include the public health and healthcare industries. But now we're at a point in this movement where actually public health and healthcare industries are much more involved in this conversation. Now, there is no perfect community. No community has an A+ in all of these factors. However, this Healthy Communities checklist can serve as a roadmap to communities to understand where are their strengths and what do they need to work on. I'd like to point out that when we're talking about aesthetics, it includes landscaping, art, and a clean, well-maintained environment. When we're talking about building financial capacity, it's access to quality financial products and services. When we're talking about the built environment, it includes complete streets, meaning it's pedestrian friendly. It means from anybody from those in strollers to those using canes or wheelchairs, et cetera, that's safe for everybody to cross the street, use the street, et cetera. Also, when we talk about the built environment, it includes homes, workplaces, complete streets, parks, playgrounds, bike trails, pedestrian walkways. When we're talking about early childhood development, we're talking about early childhood care and education. When we're talking about employment, it includes creating jobs, retaining jobs, and job training. When we're talking about personal and public safety, it includes addressing crime. Public transportation includes transit-oriented development. And social networks and social environment includes community engagement and democracy building. Okay, so we all know that to employers, any employers in the private sector, in the nonprofit sector, in the government sector, health matters, because look at these tremendous costs of poor health. Poor health causes low morale, presenteeism, which means low productivity, absenteeism, employee retention and turnover, health plan premiums that can go through the roof, workers' comp, and disability. So, what should businesses do? This, if there are any notes that you take, I highly recommend that these are the most important things that you take away from this presentation. Number one, prepare your story by putting it in a healthy community's perspective. Talk about that there's an inextricable link, a complex link between health, income, and education. We can't address one without addressing the others. Talk about why zip code matters, how zip code tends to be a more accurate predictor of our health than our genetic code. Talk about how your work is fundamental to healthy communities. List which healthy communities components are important to you and why. And when I talk about healthy communities components, I'm referring to those components that were on the checklist I just showed you. And talk about the economic, financial, social, and environmental value of your work. Number two, reach out to unusual suspects in healthy communities. Why I say that is that typically people usually go just to healthcare, and that's great and that's important, but that's not the only component of health as we've talked about before. Reach out to experts in employment, financial capacity building, the built environment, public transportation, et cetera. Learn their perspectives. Identify their community and economic development priorities. Ask them about community collaborations that they'd recommend you join, and then invite them to participate in the community collaborations that you're already a part of. I'd like to emphasize this last point. Consider bringing your top staff from not just community relations, but government relations, market research, marketing, PR, human resources, et cetera. This is why I say that. They can share their expertise, an accountant can share their expertise on measurement. A marketer can share their expertise on how to get out the word. So the point is, typically when you see corporations, and this is not in all cases, but typically what you see when corporations say, I want to get involved, it's the community relations head or government relations head. But there's so much other expertise that they bring to the table. So make sure that you're leveraging the other expertise. It's not just about them giving financial expertise or financial, for example, contributions. It's also about they can help you market, they can help you with accounting, they can help you with PR, they can help you with understanding what are the HR issues that you're seeing in terms of, for example, job training or retention. Okay, so when the Healthy Communities list of Healthy Communities components is from a publication I wrote that was published a couple years ago, actually showing bankers how to invest in healthy communities and make sure that they were getting Community Reinvestment Act (CRA) credit for it. In 1977, the CRA was passed, and basically it was saying that it was illegal for banks to redline, to ignore communities where they already have a geographic footprint. And so what the Federal Reserve says is you have to make sure that you're, of course, practicing safe and sound banking rules, but at the same time, you have to make sure that you're not ignoring communities that traditionally have been divested. And so under the CRA, banks often help invest in small dollar loan programs, affordable housing, workforce development, et cetera, et cetera. And so what a lot of them were asking me was, okay, so now we're talking about healthy communities, what is that? So I created that healthy communities checklist. But then they were asking me, well, who do I reach out to? So with this checklist, if this is available all online, is an appendix of healthy communities experts. So you saw that there were 16 components of healthy communities, components like affordable, a built environment, which includes affordable housing, like employment, education, et cetera, et cetera. So what I did is in this appendix is I created a list of about 50 organizations who are experts in each respective healthy communities components. And let me give you an example of one of the experts. CFED is a national leader in asset building. Of the healthy communities components, the three areas that they have the expertise in is building financial capacity, the built environment, and then entrepreneurship. This is a list of their programs and policy agenda. There's in this appendix, it shows a list of all of the different experts who are in each of these healthy communities components. It's not a complete list, it will never be, but the point is it's a starting point, so you can see, okay, if I want to know someone who has expertise in employment, you can actually sort it and see, okay, these are all the national organizations or regional ones that are known nationally for working in this space. Okay, public health. We haven't talked that much about public health yet, so I'd like to just point out that public health entities throughout the country are going through the accreditation process in partnership with the Public Health Accreditation Board. Some of them have already got certification, some are going through the accreditation process. Here are some of the standards. And what you'll see from this is that all of them have expertise in community health, so the social determinants of health. All of them have to participate in or lead a collaborative process resulting in a comprehensive health assessment, community health assessment, as well as community health improvement plan. They know about the social and economic factors, as well as knowing how to support prevention and wellness. So I highly encourage you, if you're not already working with public health entities, reach out to your public health entities in your communities and ask them what are they doing to meet their accreditation standards, and ask them which community collaboratives to get involved with. Okay, another thing that I highly recommend that as employers that you do, regardless if you're from the nonprofit, private, or public sector, is to focus on workforce development. If you want to address health, you have to talk about jobs. So the goal of the workforce development ecosystem is that they assist low and moderate income individuals in accessing ongoing skills development and credential attainment so they can get jobs and careers that can sustain their families, as well as build long-term financial success. So what are the components of workforce development? They include employment, meaning creating and retaining jobs, and job training, like we've talked about before. This includes cradle-to-career community collaboratives. So for example, Strive Together is one example of a national network of organizations. Commit in Dallas is one of them, where they talk about how do you make sure that kids from pre-K all the way through higher ed are getting access to a streamlined approach to understanding who's doing what, where are the gaps, and how can the community work together to fill those gaps so that all kids have the opportunity to advance where they need to so that they can succeed in their careers. Also, there are industry-led career pathways. Can I see a show of hands of who's familiar with career pathways? Anybody? Just a little bit? Okay. So career pathways means that rather than having a scattering of job training and programs, et cetera, what it means is rather than the old dichotomy of either you go to college or you don't, or go to graduate school or you don't, the idea is saying there's a pathway where you have an on-ramp and an off-ramp continually through your educational and your career path. And so what it means is that rather than saying, okay, you have to take time off from, you have to dedicate completely yourself and your time completely to school, what it means is, for example, you can work part-time and get job training at the same time, and you keep on building up and up and up, so that it's not either get a four-year degree or nothing. You can actually build up and get credentials. So there's on-ramps, there are off-ramps along the way, there's stackable credentials, and it also means that there's a huge support system to navigate this pathway, as well as just address all the social services and other needs for someone to be successful. So wraparound services support workforce development clients and their families. I'll refer to this later, the two-generation approach, which means that you're focusing not just on the child or just on the parent, but both at the same time, meeting their needs. Another component of workforce development is entrepreneurship, and last but not least, helping students, workers, job seekers, and entrepreneurs build their financial capacity. Okay, number 3 in terms of recommendations for action, advance health-promoting laws and policies. Often laws and policies are the most effective, sustainable, and cost-effective tools to improve community health and achieve health equity because they change the system, the norms, and the environment. There are different ways to advance laws and policies, such as informing, influencing, advocating, and lobbying. Let me give an example of the power of laws and policies. Pathogenic neighborhood conditions are conditions often seen in low and moderate income communities. They were created and are supported by laws and policies, but health-promoting laws and policies can help end these inequities. And these are some of the pathogenic neighborhood conditions that have been mentioned in previous presentations. Number 4, address the elephant in the room, racial inequities. We will never move forward if we do not address racial inequities. I highly recommend getting training on how to develop a shared understanding about inequities, how to have productive conversations about them, and how to eradicate inequities. It would be remiss if I did not include a quote from David Williams from Harvard University School of Public Health. As he says in the Journal of Health and Social Behavior from several years ago, although the majority of poor persons in the United States are white, poor white families are not concentrated in contexts of economic and social disadvantage and with the absence of an infrastructure that promotes opportunity in the ways that poor blacks, Latinos, and Native Americans are. The neighborhoods where minority children live have lower incomes, education, and home ownership rates, and higher rates of poverty and unemployment compared with those where white children reside. In 100 of America's largest metro areas, 75% of all African American children and 69% of all Latino children are growing up in more negative residential environments than are the worst off white children. This matters. Number 5, as you decide how to address health and safety issues, engage community entities and residents. Their engagement is critical to your success in all stages of your investment and intervention. Use your expertise to promote a culture of health in your communities or markets. For example, you can write an op-ed piece in the local paper, share your research findings with the city council or in other public forums, sit on boards of local nonprofits. Number 7, cultivate and promote a culture of health in your workplace. For example, do you promote a family-friendly workplace culture? Do you consciously try to reduce stress in the workplace? Is the food in your cafeteria, vending machines, and at meetings nutritious? Do you promote physical activity, such as by making your stairwells attractive and providing exercise classes on premises? And last but not least, number 8, define success not only as learning what works, but learning what doesn't work. Reward partners for sharing these learnings. Incorporate these learnings into the feedback loop is actually what Alex talked about from the Clinton Foundation. This process of continual improvement is vital to creating a culture of health. And I have some recommended resources, and this PowerPoint will be available online so you can see all the resources. Thank you so much.
And thank you, Elizabeth. I know we were going through really quickly at the end, but again, the slides will be available, and we'll have a little bit of time, hopefully, after the speed dating to do a little bit more question and answers.